The product itself is it's a double balloon colorectal catheter. It's in the medical device sector, and it's a colorectal catheter, so it's used on all applications for colorectal within radiology. Right now, as I said at the beginning, we started off using it for intussusception reduction, but now we're using it with another procedure called virtual colonoscopy, where it's a colon cancer screening test. We also use it for rectal contrast CT, or the other term for it is CT enema, and we use it with those patients. If it's a pre-scan for a patient that's going to surgery, you reuse it as a diagnosis to identify if there's any strictures or any lesions in the bowel, to give the surgeons a roadmap to where they would go and do the resection. And then after the patient has these resection, then they come back to radiology again to look at the sutures where they took out the bowel. And if this patient has a leak at that suture, it causes a major problem with the patient as far as recovery goes. So it's very important to get a nice study after surgery to make sure that anastomosis, which is those sutures, are not leaking. And with my catheter, we're able to actually put more of normal pressure that would be the same distension of stool or bowel in the bowel. So we're able to distend that bowel to that level of distension that would test that anastomosis to make sure that there is no leakage there before that patient gets discharged. And we have found a few cases where there were leaks, and we wouldn't have seen it any other time if we didn't have the catheter. So it is proven to be a good diagnostic and preventive medicine tool. And it's saving the hospital a lot of time and money, and it's saving the insurances a lot of money. When I first started off, pediatric was the focus. However, once I started doing my research, I realized that there are other applications. And I actually test those applications doing my research in the clinic, not in the clinic, but in the laboratory. And I identified that we could use it for other cases within radiology. So my segue, I would say, from pediatric to adults was one of those because I am in the field. I was able to visualize what other application it could be used for, which is a little different than someone that was on the outside trying to understand what needs to be done in the clinic. Since I had all the clinic exposure, once I started doing my research, I realized that, yeah, this could be used for these other procedures as well. So I think it was more for me of having a background in the field versus looking outside in. I mean, for all the pediatric departments out there, all the pediatric radiology department out there that has that performs a lot of intussusception reduction, I think you should definitely look into the Cephus catheter, get more information about it, understand how it works, and see the benefits that it'll bring to your department. Because, like I said, in some hospitals, they've went from 20 minutes to 1 minute in procedure time. So it's a very valuable tool, and it can be used in several ways. There's some pediatric radiologists that doesn't like using catheters, I mean balloon catheters internally. Well, as with the Cephus catheter, you could actually use the proximal balloon on the catheter and seal from the outside and still get a better results than using a non-balloon catheter. So I think either way, you're going to get benefits from the Cephus catheter, whether you use the internal balloon or not. You will still save a lot of time, and you will, improve your patient care in your department.